I'm Paul Collier, I'm the founder of Stem Cells 21. At the beginning of my company, we were utilizing autologous stem cell therapy derived from adipose tissue and bone marrow. And over the past 10 years, we've evolved into using a younger source, which is umbilical cord tissue, as there's such a predominant valuable source of stem cells and hold a potentially therapeutic, higher therapeutic level than aged autologous cells. In our 10-year clinical history, we performed well over 1,200 cases, but also our laboratory section of the company supplies stem cells to some other medical institutes. So the collaborative number of cases treated with our mesenchymal stem cells well exceeds 2,000. Well, in the environment of your body, you have mesenchymal stem cells performing various roles on a daily basis, whether it's modulation of the immune system, the stimulus for tissue regeneration, healthy organ turnover. And the issue is with age and degenerative disorders, the number of cells and their therapeutic potential weakens. So we are just replacing a new vibrant wave of these mesenchymal stem cells which you have within your body anyway. So in our opinion, the majority of patients are a candidate for stem cell therapy. So within our clinical use of stem cells, we look at the microenvironment of the human body. So we look at things like inflammatory cytokines, blood health, organ health. So we want to make the environment of the body less hazardous and more harmonious for repair and regeneration. So we utilize detoxification elements, nutritional elements, oxygen therapies to really trigger this environment for stem cells to flourish. So in our clinical experience, something like an injury or a trauma can have a long-lasting result from stem cell therapy, as the tissue would be regenerated, and then you would theoretically need to injure it again or degrade it again to show the symptoms of that condition. But some diseases are degenerative in nature, some diseases are genetic based and progressive, and symptoms can start to come back as the disease progresses again. So regenerative medicine and stem cell therapy can become almost an annual therapy to enhance the body's repair mechanism, to hopefully bring the tissue regeneration at an equal or better rate than the degenerative nature of the disease, allowing the patient to not show symptomatic development. Sure, every day of the week we're treating orthopedic, musculoskeletal disorders, connective tissue, inflammatory-based diseases. We do treat more obscure conditions like neurodegenerative disorders, aggressive states of immunity, degenerative eye disorders, major organ failure disorders. But every day of the week we're performing orthopedic chronic pain management, but we do treat an array of conditions. Everything can benefit when it's in a degenerative nature. Probably the most hardest to treat would be a genetic anomaly-based disease. Then you have this continuous progressive nature where even the transplant of healthy stem cells will not really touch that condition because of the genetic error in the cell in the first place. So some of our most common conditions treated are things like diabetes type 2, inflammatory lung diseases like asthma, bronchitis, emphysema, COPD. Of course, musculoskeletal disorders and degenerative spine disorders like dehydrated disc, degenerative disc, muscle weakening, fibrotic and inflamed tissue in the spinal columns, joint and cartilage degeneration, which is osteoarthritis. A lot of immune-based disorders like rheumatoid arthritis, SLE and lupus, they really respond very well to stem cell therapy, especially mesenchymal stem cell therapy, which is our prominent cell we use in all therapeutic applications. So as I mentioned before, if a disease is progressive in nature, we do follow a follow-up program, i.e. an annual use of regenerative medicine to tackle the disease. But after stem cell therapy, we will give a unique package of stimulating factors to enhance the stem cell activity when the patient leaves and goes home. We want this regeneration stimulus to continue, so we use microRNAs, nutritions, enzyme therapies, and also the secretome of the stem cells, which is the array of growth factors, cytokines, EVs, and other proteins that the stem cells produce. We will give to the patient when they go home, and this keeps a triggering action, a continuous mechanism of repair to the patient. Obviously, in the clinical setting, we can do this in a more enhanced manner by using actual cell therapy, but there are ways to continue this repair mechanism at home. My medical team has a vast experience in stem cell therapy. Our medical director has nearly 20 years in clinical experience with stem cells, dating back to early trials where they would perform direct heart injections for heart failure with stem cell therapy. And this, of course, has evolved to a non-surgical based intervention where we can inject cells intravenously, etc. So our medical director has nearly 20 years experience in stem cell therapy. Myself, I've been involved in the industry for over 15 years now, and Dr. Nicholas as well, over 10 years as a scientific key figure in the industry. Our attending physicians have all been with us over 5 years and with their own hands treated well over 300 to 400 to 500 cases each. So as a whole, our team is very, very experienced. If you look at the individuals and add up their collective history, you're probably breaching 100 years of collective experience in clinical application of stem cells. Our nursing departments and the staff that care for our patients, they've been with us well over 5, 6, 7 years. Our head nurse who attends to every stem cell patient, 500, 600 patients she's looked after. So it's a very experienced team. So we're looking at a human cell. We're looking at a cell that is performing various actions in your body. We are probably performing, in my opinion, a very safe therapy. I believe it's safer than taking a pharmaceutical drug that only has some study data, whereas we have the human history, the evolution of humanity, who has mesenchymal stem cells in an active role on a daily basis. For me, there's nothing safer. It is human-derived cell therapy. This is not some foreign body. This is not some abnormal structure that's entering your body. It's something your body is used to, and it's something your body thrives from and uses to repair itself. So for us, safety is not in question. Efficiency in indications is in question, and some obscure conditions that has no data and clinical history, we cannot say the outcome measures. But as a whole, MSC therapy, in my opinion, is very safe. It has FDA approvals for things like graft versus host disease. Now, when people perform organ transplants, they will utilize cellular therapy to adjust the aggressive immunity that would reject the organ. So for us, safety is not in question. Obscure clinical conditions, the efficiency in those could be in question. But over the world as a collective, over 1 million people have received MSC therapy in different trials, in different institutes, in different parts of the world. So how many do you want to see treated before it's globally accepted? You can accept a heart medication with a trial of 500 people with not very good outcome measures, and it can be approved globally. So for us, it's a bit of a strange scenario. The public perception needs to be changed. So again, with our clinical experience, we treat a number of the highest caliber athletes for reoccurrence injuries, random injury recovery, as well as endurance enhancement, lengthening their professional careers by reducing injury rates, etc. So in the sporting world, regenerative medicine, I think, is a crucial component. You have to understand any surgical intervention leads to potential adverse reactions in the surrounding tissue, arthritic progression in limbs after meniscus surgeries, lower back surgeries developing to the requirement of disc fusions or tissue degeneration. There is such a strong link to surgical interventions leading to other complications. So for us, why would the world not embrace this human-based regenerative therapy prior to surgical interventions, and as an immediate tool for injuries and a tool to optimize the human body to perform at a higher level? So for us, there's a very strong link with sports. Within our clinic, we perform normally an intravenous infusion and a set of localized injections. We want a number of mechanisms to take place to adjust the body's systems and the systemic manner of a disease, but also the localized tissue. So when we inject the MSC, they can perform a number of actions, which Dr. Nick will explain now. Yeah, so the MSC, they can come in a localized area that's chronically inflamed. They can dampen this aggressive immune response that's causing inflammation in the tissue. And one thing, when a tissue is chronically inflamed and there's cytokines and molecules like tumor necrosis factor, repair cannot take place. It's an inhibitor of regeneration. So when the MSC perform these actions of dampening aggressive inflammation, then repair mechanisms can kick in and the tissue can actually repair itself. So not only MSC can stimulate tissue repair, but they can adjust this aggressive immunity response, which allows for regeneration of tissue to occur.